Okay, now let's discuss different types of uterine fibroid. The type of uterine fibroid is dependent on the location of this fibroid. There are different types that grows on different location. What is fibroid? Fibroid is simply a benign tumor of the smooth muscle in the uterus. We have three types of uterine fibroid. The first one is intramural fibroid. This intramural fibroid is the most common type of fibroid. The most common type, okay, is located within the muscular wall of the uterus, okay, and this type of fibroid causes the uterus to enlarge because it grows very big. You see some women, their tummy will protrude so big and you would think they are pregnant, but they are not pregnant, okay. This is the type of fibroid they are suffering from because it really grows so big, okay, and it causes heavy bleeding and pain during menstruation, okay. Now let's talk about submucosal fibroid. That's another type of fibroid. Submucosal fibroid grows beneath the inner lining of the uterus, okay, and they protrude into the cavity of the uterus. This type of fibroid causes prolonged period. If you normally have period for 7 days, this type of fibroid can make you to have your period for 10 to 15 to 20 days, okay. Yes, you're going to have a very prolonged period and heavy bleeding, okay. And this type of fibroid causes infertility. How does it happen? Because this fibroid protrude into the cavity of the uterus, and when you're pregnant, as the baby is growing, the fibroid is growing, so the baby and the fibroid will be struggling for space in the uterus, okay. This can cause the death of the baby, okay, and it can also cause infertility because most times it blocks the fallopian tube. As it's growing, it blocks the fallopian, and when you know that when it blocks the fallopian tube, you cannot conceive, okay. So this type of fibroid causes infertility. The third type of fibroid is called subserosal fibroid, okay. This type of fibroid grows on the outer surface of the uterus, bulging into the pelvis, okay. This type of fibroid causes pressure on the nearby organ, okay. This causes constipation, causes frequent urination, okay, and pain on the lower abdomen. Now, can uterine fibroid hinder pregnancy? From my explanation, you should be able to answer the question now. From the three types of fibroid that I explained, you already know that submucosal fibroid can hinder your pregnancy because it bulges into the cavity of the uterus and it competes for space with the fetus, okay, while growing, okay. As the fetus is growing, the fibroid is growing, and this is a very big challenge, okay. Can cause the death of the fetus, okay. This type of fibroid can cause infertility because it also blocks the fallopian tube, okay. It can grow so big and block the fallopian tube, and you know, if the fallopian tube is blocked, there's no way you can get pregnant, okay. So submucosal fibroid can actually cause infertility. So if you check my previous video, you will see that I explain the symptoms of fibroid, okay. So if you're having any of these symptoms, quickly rush to the hospital, okay, so that you will be diagnosed properly and treated properly, okay, because fibroid can actually cause infertility. Now, if you have learned something from this video, kindly give this video a thumbs up. Don't forget to share and subscribe to this channel, and I'll see you on my next video. See you.